Closed captioning for Lakeland Currents is supported by the Minnesota Department of Commerce, Telecommunications Access Minnesota, and Nisswa Tax Service. Nisswa Tax Service, tax preparation for businesses and individuals. Across from City Hall in Nisswa and online at nisswatax.com.
Hello again, everyone, and welcome to Lakeland Currents, where tonight we're going to be talking about an emerging health problem in Minnesota, wood ticks and deer tick diseases. And we're going to start our program tonight with a little piece by Annie Cook about one of our guests, who we'll come back and introduce to you to in just a minute.
Kurt Wisher and his dog Snickers have something in common. They've both been treated for Lyme disease. Snickers, though, was the only one to have a positive test.
And while we were working in that area, she got bit and I got bit by a tick, so I just wanted to be tested, so I got tested for Lyme's. This is what ended up happening with me. And then I tested negative.
But even with the negative test, Wisher's doctors put him on doxycycline, the same medication Snickers was taking.
A negative test is common with Lyme disease because in the early stages, the disease doesn't always register in a blood test. So physicians most of the time go by symptoms, not test results when they're making a diagnosis.
To be real honest with you, I don't know if they probably still don't know for sure if I had it or not. I mean, you know, but they treated the symptoms rather than, you know, the bite.
Wisher did have some symptoms. First, he pulled a tick from his stomach. Though the telltale bullseye rash never appeared, he did feel fatigued. And much like Snickers, he experienced pain in his legs.
What got me more concerned about anything was the fact that they hurt after being in bed all night.
The antibiotic Wisher was prescribed did lessen the pain, but he has had periodic soreness nearly 3 months after treatment began. He also had some adverse reactions to the medication. He became extremely sensitive to sunlight, something that caused him to have severe burns on his hands.
The way I explained it when I was talking to one of the doctors, I said, it almost feels like they put gasoline on my hands and lit them on fire.
And though that wasn't enjoyable, Wisher's early treatment could help prevent his symptoms from advancing into a chronic state. For Lakeland News at 10, I'm Annie Cook.
My guests this evening are here to talk about a variety of things that we can cover in the tick business. Kurt Wisher, who you just saw in this little piece, is the reluctant visitor because he is a victim from this disease himself, so we'll get to him in a moment. I'd like to welcome Dr. David Buran, who is the Chief Medical Officer of Brainerd Lakes Health, and Dr. Diane Kendall, who is a pathologist at Brainerd Lakes Health. And Kurt Wisher, who is a victim, a barber from Staples. He's also an EMT for the Lakewood Health System. So welcome to the show. Appreciate all of you taking time to come here this evening. And maybe we could just kick the show off a little bit by talking about where is this disease really starting to occur?
Well, Ray, this disease, Lyme disease primarily, has been in Minnesota for 20 years, but it is getting more and more prevalent in this area. In fact, Crow Wing County is probably ground zero for Lyme disease in the state of Minnesota. It's actually come across the country from Connecticut, where it was first described in Lyme, Connecticut. There was a cluster of children who were first diagnosed with juvenile rheumatoid arthritis. And after a further study, it was determined that they actually had an infection that was carried by ticks. And so it got the name Lyme disease because of the name of the town, Lyme, Connecticut. In the 1980s, I think about when we first began to see Lyme disease in this state. And it came across the country, Wisconsin, western Wisconsin, eastern Minnesota, and then kind of follows the river up from the Twin Cities. There was a map on earlier that showed the areas in the state that are the hardest hit. In 2007, there were 1,239 reported cases in the state, and that was a 36% increase from 2006. The latest statistics for Crow Wing County are 2006 numbers, and there were 136 reported cases. And that's probably low. most of the time, or frequently, cases don't get reported. So the thought is that it's much more prevalent than the numbers.
So people are probably going into the hospital and getting it treated, but it may not always get reported from the hospital. Is that what you're saying?
That's true, or sometimes they're suspected cases, they're not actually proven, and so we don't report those.
And one of the things that we'd like to have our viewers understand this evening is that this is a complex disease with complications in treating it and also understanding it and diagnosing it. I think that's fair to say, isn't it?
Yeah, it's a difficult at times to pick up.
And when we say the Crow Wing County is kind of the epicenter of this in Minnesota, does anybody really know why? Why it's happening here more than the neighboring counties around us?
I'll start and I'll hand this answer off to Diane, but the, the disease is carried by what's commonly known as the deer tick, probably more accurately known as the black-legged tick, or Ixodes scapularis is the scientific name. They are feed on mammals, small mammals and large mammals. And the white-footed mouse is one of their common vectors, and we all think about deer as the common vector for the deer tick, but in fact the mouse is probably a lot more prevalent than there are deer in this part of the world, this part of the state. So as the infection gets into the mouse herd, if you will, or the mouse population and the deer population, these ticks become infected. I'm going to ask Diane to explain how that happens. And
you have an interesting description